Hello everybody, I'm Stuart.
I'm Ricky. And I'm Augustine.
And this is SmartKnee. So the challenge we were given for this year's Health Tech Challenge was to design an innovative solution that improves ACL injury prevention and recovery for Louisiana's young athletes.
ACL tears are extremely devastating. They can take 9 to 12 months to recover from, and they can end so many athletes' careers. And most of the worst part about this is that most of these ACL injuries, 70% to be exact, most of them happen without any contact, no contact. And so just from a bad landing, bad movements, cutting movements. And so our system is developed to prevent these things before they happen.
So, first of all, we try to understand what is an ACL injury and what leads to an ACL injury. So, during the course of our research and consulting with a biomechanical engineer at LSU Health Shreveport, we learned that most ACL injuries occur due to repeated strain on the ACL. So, no one can see the strain, not the athlete, not the coach. So, we came up with a system, a dual sensor wearable. This device uses two IMUs, one on the thigh and one on the shin, to detect ACL injury, ACL risky movements to be precise. Our risk detection is done using a principle we call co-occurrence. I will explain that in a second. For the coach, he has a dashboard to monitor the athletes live in real time. He could monitor multiple athletes, a whole team. He has access to the logs, he has access to the trend analytics and AI insights. For the player, he receives real-time haptic feedback the moment an ACL and risky movement occurs. He receives a real-time haptic feedback through a buzzer and a vibration motor. And this system costs us just $90. So how does it work? First of all, we get the raw input data from the sensors, and we fuse them together and we map them to the knee angles. And you can see our threshold here. We also perform something that's very unique, a functional alignment. People are different. People have different bone structures. So we want our sensors to align to the bone structure of the athlete. Then, when these three thresholds are met, that's what we call co-occurrence. And at that point, we say this is a risky move. We could also add velocity cues to detect impact. Our system now streams this data from the device straight to the dashboard in real time so the coach can monitor what's happening. And we're going to show you the demo shortly, but first let's tell you a little bit of challenges we faced developing this. So the first challenge was time. We only found out about this competition on the 16th of October. So we had 2 weeks, November 2nd, to develop what we had. And we built the prototype and we built the software. We had to locate the parts, we had to get them in time. Some haven't arrived to date, but we had to work with what we have. And then we had to do the calculations, do the mapping, and then we have to translate the information reliably. So let's show you what we have.
All right. So as you can see here, this is the SmartKnee dashboard. So this is what the coach is going to see whenever they open the app. And as you can see, every single player on the team has their own card. So on the card, you can see the name, the age, and the number of movement alerts. So movement alerts are how we determine whether or not somebody's made a risky movement. The more movement alerts, the more risky moves they made. So if they have 5, that means they made 5 risky moves. And whenever you make a risky movement, you're going to hear a buzz or a beep, letting you know that the person is making a risky movement. The first thing that any coach is going to need to do is calibrate the device. So you can either calibrate the device on the web page or on the device. We're going to show you both just to show you. So there you go.
Up, down, up, down.
So calibration is incredibly important because different people have different bone structures. And you know, because somebody might have a longer tibia, somebody might have a longer femur, we choose to do calibration just so that we know that it's going to work for no matter who it is, right? Now, because it's calibrated, we can drill down onto a specific athlete. So we're going to click the brain 3. And as you can see here, we have the athlete information, the knee visualization, and the joint angles. So as you can see, as Ricky stands still, it doesn't move, and as he moves, then it changes. So you can see it's being live streamed right now. You have the flexation, the valgus, and the rotation angle. If he moves his leg up and down, we'll see. And as you can see right there, if he made a risky movement, for the purpose of the demonstration, we made it very sensitive. We didn't want to actually tear our ACL. So here it logs the movement, we have the movement risk, and we have the number of alerts. But what does that mean? What is a movement alert?
So what we've done is we've integrated an AI assistant for coaches, and it's just for coaches to make sense of some of the biomechanical data. Because if they're a coach, they may not be versed in, for example, like what flexion angles are and different things like that. And so what they can do is they can go to generate AI analysis, and that will give them a risk assessment, an AI generated risk assessment, risk profile for each individual athlete. And we'll have the risk assessment, key concerns, specific recommendations. And then if they have a question, like for example, what is a valgus angle? They can go down to the chat box and they can ask the AI assistant, what is a valgus angle? And instantly it will answer them and give them a comprehensive response. And then down below, they can clear the chat history and they can start all over.
One more thing we'd like to show you is this historical trends tab. So the coach is able to see the entire team's risk assessment. So over the time of the last 7 days, it seems that the risk assessment has spiked on November 11th. It seems that they've started doing more training, more high intensity training, and we also have a calendar heat map to show the specific day in which the intensity was higher. So the darker, the more purple it is, the more intense it is. I can also drill down to a specific athlete and see their individual risk scores and stuff like that. And then I can export the file if I want.
So we use Azure NRF board as the major MCU for this device. It can do machine learning classifications. It has BLE, and that enables it to, you can connect multiple devices to an app because it's BLE, it's not Bluetooth. And we have a 9 degree of freedom IMU, we use 2 of them.
And now for the software. So for the back end, we went with Python, and then for the front end, we went with Streamlit, and that utilizes HTML and CSS to power our web pages. And then of course for the AI assistant, we went with Grok AI, because Grok AI, as you saw, has instant feedback, and it's very fast, and they actually use it in Formula One racing for the race cars. As they drive, they get instant feedback.
So the impact of this, I don't think can be understated. The thing about it is there are similar devices to this that allow you to stream knee angles or knee information to the computer. However, ours is different in a few key ways. First, it allows you to connect to multiple devices at once. So you could have 30 athletes all at the field. Because we're using Bluetooth Low Energy, you can connect to multiple devices at once. Another thing is the how cheap it is. It only costs about $90 to make that, and we could even make that cheaper than that. That is really important for scalability when it comes to, especially rural hospitals who have a lot tighter budgets, and in public schools in Louisiana who might have tighter budgets. Like other things similar to this cost thousands of dollars and subscription fees and stuff like that. Another thing is that it's very coach friendly. Other devices, you need to be a biomechanical engineer to understand what's happening at all, right? So this makes it incredibly coach friendly and allows them to understand what's happening without being super versed in medical knowledge. This is our future roadmap. So right here, we're at the prototype stage. As we continue this project, we would like to do machine learning classification of risks. So instead of just having a general risky movement alert, we would like to drill down to specific movements. So maybe you're cutting wrong, maybe you're landing wrong, and then we can use that to offer specific insights, specific drills that you should do. After that, we want to put this on a mobile device because currently it's only on the computer on a website. So we'd like to put this on a mobile device so that you can use it on your phone, and then we would like to partner with someone to do pilot testing and eventually launch the product. Real quick shout out we would like to give to Giovanni Salitro at LSU Health in Shreveport. He is a biomechanical engineer and assistant professor of orthopedic surgery who we consulted for this project. He pointed us to some great resources, and he was an inspiration for this project. So we were very grateful that he was willing to talk to us.